The next person to come is Dr. Shubhra. Aesthetic looking Shubhra is one of the very proficient oculoplasty surgeons trained at Shankara Nethralaya. She has gone abroad, trained herself further, and right now she is one of a leading person who's going to be talking to us on oculofacial aesthetics in India, what beyond.
Thank you so much for that kind introduction. Otherwise, I feel everybody out here is looking beautiful inside out. So thank you so much. Thank you, Feroz, for inviting me for this wonderful session and symposium on what's beyond. Okay, it's just taking a bit of a time. Yeah, very good. So, I always feel there is always a greener patch besides what you are already doing, and Dr. Kasturi has also shown wonderful procedures. Now, I will be taking you over what I am doing beyond in oculofacial aesthetics in my years of practice. These are some of my credentials and the disclosures. Now, we have been always talking about injectables, doses, blepharoplasties, brow procedures, and the new modalities which have come into it. I'll be taking you over to the different side of the aesthetic practice, which will be more holistic and some more technology driven, because the world is moving to minimally invasive and more technology driven practices. So the first thing I'm going to talk about is a new tool in our kitty, which is the Plexer or the plasma energy. And what it is, it's a soft surgery. Basically, it's a tool which allows you to do a lot of minimally invasive procedures for all the kinds of skin blemishes and other blemishes. How does it work? It is basically the fourth matter. You have the liquid, gas, and solid, and then there is plasma, which is present in our atmosphere. So when it is given in a controlled manner, it sublimates the tissue, and it actually helps the collagen to rebuild from within. So the difference between a plasma and the regular cautery systems which we are using is that the cautery system is still cutting and coagulating, where this is sublimating. So you're not cutting or coagulating or damaging the tissue. There is no collateral damage, and you achieve the result which is much more natural. So there's no downtime. It's very, very cheap, non-invasive. You can do it in the outpatient department facilities. And I have just started doing it for the last 6 months. The experiences are building up. So these are some of the indications which I have been working on as a non-surgical blepharoplasty. You have to select your patient wisely, of course. The wrinkle reduction, so that is a kind of a counter tool for your Botox and fillers. Different types of lumps and bumps. Xanthelasma is a boom with this, acne and other skin blemishes. So these are some of the videos which I will just share with you. So this is a patient which is having syringomas. Now remember, syringomas in the dermatology in our practice has no treatment. They keep recurring. And this was my first case. And of course, the patient was kind enough to let me do it, because I was like, I don't know what's going to happen with your syringomas because they tend to reoccur. And to my surprise, it's completely vanished, because what has happened is it's not only evaporated the whole tissue, but it has also led the collagen to build in, and there is no more recurrence of the lesion which is happening. Of course, we can use it for the lumps, bumps, moles, seborrheic keratosis, active acne, and the scar management. So this is just like a simple pen tool which you can use, and it has a fine tip, and the difference is we are not touching it to the skin, but we're creating the plasma arc between the skin and the tip. This is the fine wrinkle reduction. Now these treatments, if there are just a standalone lesions, just take one sitting. But lesions like xanthelasma, blepharoplasty, or wrinkles would need 4 to 5 sittings at 1 month apart. So you're just kind of dividing your sessions over a period of time. So this is one of the patient who had the cyst, on the lateral canthi area. In routine, we would have used the RF cautery or excise it. And this is on table. If you just see after the 2 weeks, there is no scar. The patient has a natural looking skin. And I could just kind of evaporate it. So you have to be patient doing it, because we're very used to cutting and coagulating. Here you have to go layer by layer and kind of use it. So this is a patient with syringoma. You can see it completely vanishing. There is no recurrence. Of course, you have to combine it with good skin care. Seborrheic keratosis, again, complete resolution. Chalazion, I've started using in chalazions. I have started using in a lot of ocular surface issues, and we are getting very, very good results. Scar management, this is one of my first patients where I started. Along with the local application, I'm working on his collagen. So you can see the scar has come down drastically. Now the second session would be to bring down the further contracture, which is there in the periocular area. Another patient who sustained RTAs. So we did the initial suturing, and then later on I gave him the Plaxer treatments, 3 sessions along with the topical applications. Xanthelisma, I have done around 3 or 4 cases now. So you see after the session, this is how the microdot subluxations will look like. And this is the fading of the xanthelisma after the 3rd session. So we are not going to create any scar. We are not going to create any crater. We are just evaporating it layer by layer. And at the end of it, it just becomes part of your skin. Your natural skin actually comes over. So I feel it's a big boom of technology for xanthelisma, which is very difficult. Dr. Kasturi touched upon the threads, which is PDO. I'm doing Aptos. Aptos are the group of threads which is from Georgia. And these are wonderful threads because they come with the HA coating. And I have used it, again, an initial experience of around 10 cases, where now I've started doing it and combining it with Botox filler surgeries for brow lifts, for facial lifts, and so on and so forth. So this is the patient where we did the whole mid-face and the jawline lift with multiple entry points. This is how we do the marking. We plan it pre-operatively and achieve our results. So this is just a short video to show you how the threads are. So they come in different lengths, sizes, and material depending on the area where we are doing, and you can get the immediate results on the table. So this patient with the brow and nasolabial folds which has been treated, look at her brows which are much more arched, stabilized, and in position, and the nasolabial folds have softened quite a bit. This is a patient who had previously undergone blepharoplasty, did more for her facelift. This is immediately after on table. Another patient who wanted a more oval shape to her face, and we could actually lift it non-surgically with the thread treatments. So this is the same patient where I did the nasolabial just to make you aware of how the nasolabials actually can be taken care of without doing fillers, without doing anything, which are just minimally invasive, and the threads actually last for 18 months to 2 years, and this is how you can soften. So that's why these are all soft procedures which we are doing. We are not going to eliminate it. I'm a big fan of skincare because I believe without the skincare, without the healthy skin, even your surgical results are not going to be optimum, especially in the Indian skin type. So again, this was just a video shot a day before I was landing in Mumbai. So I'm trained in the Zeo skincare, and I tried something new which is called the red carpet peel. So you can actually work around with your peels before the surgery, after the surgery. People want quicker results. They want to go to the work. They have occasions to attend. So I think as surgeons, it is very, very important to combine these procedures in your kitty and take part of it. So I prefer to try everything on myself before I can offer to my patients, including the plasma, and wonderful results which we have seen with it. This is one of the patients who had come to me for dark circles. So we did plasma to remove the extra skin on the upper lids. We work around on her skin. These are no filters, believe me. And of course, this is a selfie sent by a patient. But I did ask her, have you used the filters? And in person, she looks even better. So we worked on her with Botox fillers and her skin management and complete transformation of the person. So the confidence and the level of change which patients find is another level. A new filler on the block is Profilo. This is a wonder filler for neck laxity. So anybody who has neck folds, neck laxity, this works wonders. Again, I tried on myself, though I don't have too much of laxity, but just to see how it works. And it's a very, very quick procedure, which you do on day 0 and day 30. And the procedure's effect lasts up to almost 6 months. And it gives that tightness because what it does is it's a 3.5% hyaluronic acid which is present. So maximum amount of HA which we have seen in our fillers, it just blends into your subcutaneous tissue and kind of hydrates it. So it rebinds and rebuilds your collagen in addition to what we have. I've used it. So I think in our practices, I'm not a big fan of it for mid-face area or forehead, but under eyes and neck, it does wonders. This is again a girl I just did 2 days back, and this is how she is after 24, 48 hours. She does have a little bit of fluid collection, but that's natural to happen after HA, lasts for 2 to 3 days, and then the patient is good enough. So I'm kind of switching away from the deep bone injections, fillers, which we give onto the inferior orbital rim, to more superficial fillers along with skin therapy, because I think that's going to create much more profound results for the patient. Of course, if there's grade 4, grade 3, this is me again. What I want to bring your focus on is that if you touch your brows and periocular area and make it enhanced, in whatever way you can, the complete feature of your face changes. So I'll just show you again. This is me. This is me. I was with scanty brows, no lashes. And this is me after the Wonder tools to enhance your brows. So the thing is that periocular area is a very, very important area for us to enhance, because it not only changes the complete features, it completely changes the emotional background for the patient, in addition to whatever we are doing. Micropigmentation is another tool which we have in our kitty now. So any patient who has scars, who wants to have more enhanced features, we are doing it. In collaboration, whether if you can purchase, great, otherwise in collaboration with your cosmetologist or dermatologist, the tools which you have to have in your practice is the HIFUs, the radiofrequency skin tighteners, the muscle contractors, because now the generation is of doing it along with whatever procedures we are doing. I'm a big fan of the holistic science and a holistic way of treating patients, because intrinsic and extrinsic factors work hand in hand. So we have the holistic nutritionist on board, and we have also switched on to the IV infusions, which work wonders in dark circles in patients who are looking for quick glows. So if you have a collaboration of all these things, these are patients who have taken their own pictures and shared with us, and they have complete transformation in terms of their texture, the skin, and whatever features they're looking at. So all these patients have combination of surgeries and non-surgical methodologies. And thank you, Feroz, once again for having me here.
Wonderful, Shubhra. I mean, it's so nice that you could do it on yourself and show it to us. So that makes it even more reassuring for all of us.